The brawl between the federal and state governments over COVID funding continues. Now Victoria's entered the fray, hitting back at the Prime Minister for accusing the states of shakedown politics. Chief Political Correspondent Laura Tingle is with me now. Laura, last night when we were discussing the spat between the states and the Commonwealth about hospital funding relating to COVID, you said the agreement expired in June. The Federal Health Minister, Greg Hunt, says not so. Can you unpack that a bit more for us?
Surely. Look, this stems from our coverage of the letter that all the states and territories, Labor and Liberal, sent to Minister Hunt last week, which we've reported on for the last couple of nights, asking for an immediate funding boost to help them manage the unrelenting strain of health and hospital systems because of the pandemic. So the states are concerned that regular funding is not kept up with the increased costs, for example, things like infection control, testing, maintenance of bed capacity, which is going up and down quite erratically, and the capacity to respond to surges in cases. So the states and territories are talking about two different pots of money from the ones Mr Hunt is talking about. Mr Hunt is referring to the National Partnership Agreement on the COVID response, which was signed last year, which is indeed ongoing, at least until June next year. That agreement includes funding to the states to explicitly diagnose and treat people with COVID-19, ensure they get appropriate health care. But it doesn't cover all the costs that have emerged on the system as a result of COVID. The states are talking about the National Health Reform Agreement, which is the substantive funding arrangement between the federal and state governments on the health system. Now, that was also amended last year to take into account the sort of systemic impact of the pandemic, but that ended in June. And that agreement covers a range of funding and pricing matters, but in particular, the states want the existing the pre-existing 50-50 cost sharing of COVID health costs between the federal government and the states to be extended until June 2023. That's because between 2016 and the beginning of the pandemic, the Commonwealth's share of funding had actually fallen to 45%, and the states are saying that particularly at this point of the crisis, they need it to stay at the 50% it was set at when the pandemic started.
On another matter, there's a long-running court case in Canberra, the prosecution of lawyer Bernard Collaery over revelations of classified information about the Australian bugging of East Timor's cabinet rooms. There was a significant ruling in that case today.
That's right. This has been going on for some time now. It involved the famously known witness Kay and his solicitor Bernard Collaery. Now, Bernard Collaery is fighting the charges against him about revealing some of the details of this bugging. And at issue has been the ACT Supreme Court had ruled that essentially all of the evidence in the case had to be heard behind closed doors, and the ACT Court of Appeal today has said actually no, some of it has to be in the public domain because not doing so raises questions about public confidence in the judicial system. So a major win for transparency today, Lee.
Laura Tingle, thank you.
Thanks, Lee.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.